Ever looked at a prescription bottle, maybe a medical chart or, some lab results and just felt completely lost, like you're trying to read some kind of secret code?
Oh, absolutely. It can definitely feel like that. These little combinations of letters. What on earth are they actually trying to tell you?
Exactly. So today's deep dive is all about cracking that code. We're stepping into the fascinating world of pharmacy and medical abbreviations.
Our source material here is basically a big list, a document full of these shorthand terms, the kind you might see, on a doctor's notepad, a prescription package, those bottles, or even lab results you get back.
And our mission, really, is to unpack this list for you. We want to help you understand exactly what these abbreviations mean, why they're even used in the first place.
Right. And hopefully help you feel a bit more informed, more empowered when you come across this kind of health information. You might have some real aha moments about those cryptic notes.
Okay, so let's get into it. This source document, it gives us a really comprehensive look at the shorthand used across both pharmacy and, the wider medical field.
Yeah, you can almost think of it in two main buckets, which the document sort of lays out for us.
Okay.
One bucket is really focused on how and when you take medications. So dosage instructions, timing, how you administer it, that kind of thing.
Right.
And the other bucket is a bit broader. It covers things like medical conditions, different tests, procedures, general notes you might see written down in a medical record.
Let's maybe start with those medication instructions, because I think that's what most people interact with directly, like day-to-day on a prescription bottle, for instance.
Good idea. Usually the first thing you need to know is how often to take something. Frequency. And the source lists the really common abbreviations for that.
Okay, like what?
Well, you'll see OD. That means daily. Simple enough. Then BD, that's twice a day.
Okay.
If it's 3 times a day, you'll often see TDS or sometimes TID.
TDS or TID.
Got it. And 4 times a day, that's QDS or QID.
QDS or QID.
Right.
The source also mentions EOD, which means every other day.
Yeah.
And even specific timing, like 4H means every 4 hours.
Wow, okay. So it's really mapping out the whole rhythm of when you take your medicine.
Exactly. And building on that, the document also details timing relative to meals. That's another crucial piece, often abbreviated.
Yes. Like take with food or not.
Precisely. AC stands for before meal. PC is after meal. And CC means with meal.
AC, PC, CC. Simple codes, but really important for how the medication actually works, I imagine.
Absolutely vital. And times of the day get their own codes, too. Main, or OM, means in the morning. Nocte, or ON, is at night.
Okay, morning and night.
Yep. MN covers morning and night together. And then you have the familiar AM for morning before noon, and PM for evening or afternoon.
Makes sense.
There's even MIDI for in midday, and BT means bedtime.
BT for bedtime.
Okay, even the time units get shortened, like H or just H for hour or min for minute.
Right. So the source then moves on to how the medicine is actually administered, like not just when, but the method. That's right. A whole different set of codes for that. Taking something by mouth, orally, that's PO, administer orally.
PO. Okay, probably the most common one.
Probably. Then for administering rectally, it's PR. And vaginally is PV.
PR, PV. Got it. What about injections? That must be loads for those.
Yeah, there's a whole range. IM or IM, that's injection into a muscle, intramuscular.
Okay.
IV or IV is injection directly into a vein, intravenous.
IV.
Then you've got SC for subcutaneous, so just under the skin. IN is intranasal, ID is intradermal, into the skin itself. The document also lists some less common ones, like IO for intraosseous, so into the bone marrow, IP for intraperitoneal, into the abdominal cavity, and IT for intrathecal, like into the spinal fluid.
Wow. Okay, so quite specific. And it's not just where or when, but also the form of the medicine, like pill or liquid?
Exactly. The source notes specific dosage forms. So cap or caps means capsule, lick is solution or liquid. Ong means ointment, lot for lotion, and mist for mixture.
Ointment. Never knew that one.
Yeah. And for things you breathe in, you might see nebble or neb. That's for a spray or a nebulizer. And MD stands for metered dose inhaler.
Ah, like an asthma inhaler.
Right. You might even see a specific instruction like 2P, meaning 2 puffs from that inhaler.
2 puffs. Makes sense.
And for liquid medicines or things like eye drops or ear drops, you'll see GTT, or sometimes GTS or gut. They all mean drop or drops.
GTT. Okay, good to know.
For injections, generally, you might just see NJ or IJ bowl. Indicates a bolus, which is usually a large single dose given quickly, often intravenously.
A bolus.
Then for IV specifically, there's IVI for intravenous infusion. That's like a slow drip. IVP means intravenous push or rapid injection. And hold that thought on IVP because that comes up again later with the different meaning.
Okay, interesting.
And IVPB is intravenous piggyback. That's when they add medication to an IV line that's already running.
Right, piggybacking on the existing line. Makes sense.
There are also instructions about refills and just general directions. PRN or PRN means when required or as needed.
Ugh, the as needed one. See that a lot.
You do. And interestingly, the source shows several ways to say as directed by the prescriber. You might see MDU or EMP or even mod prescript.
Wow. Multiple ways for the same thing.
Yep. And non-rep means no repeats or no refills allowed. SIG means write, typically instructing the pharmacist to write certain directions on the label.
Okay.
A few more practical ones from the list. AAA means apply to affected area.
Makes sense.
WS means with food or with meals. And WO means without. LAS means label as such. These are those little extra details.
WF, whoa. Got it. Useful.
Quantity is often noted really simply with Roman numerals. So I means 1 tablet, I means 2 tablets, 3 means 3 tablets.
Simple enough.
And MIT, or MIT, specifies the total number of tablets being provided in the prescription.
Okay.
And units for measurement are pretty standard abbreviations you probably recognize. G or GM for gram, kg for kilogram, pound for pound.
Right.
Then MCG for microgram, mg for milligram, NEQ for milliequivalent, ml for milliliter. IU stands for international unit.
IU, yeah. See that sometimes.
And you also see concentrations like BenGDL, milligrams per deciliter, often for blood tests.
Okay. What about locations? Like if you're applying something.
Good question. Yeah, locations can be abbreviated too, especially for things like eye drops or creams. BNO means both nostrils. And this is where the source gives us a heads up that things can get tricky because it lists BNO with a totally different meaning later on.
Oh, really? Both nostrils?
Oh.
Okay, park that one. What else?
BEY is both eyes.
Oh.
LERE means left eye, right eye.
Okay, LERE. Simple.
O2 or O2 also means both eyes. And OD specifically means right eye. But wait, didn't the source list OD earlier for something else?
Yeah. It said OD, or OD meant daily.
Exactly. So another one with a double meaning. We're starting to see a pattern here.
Definitely.
And one more location, latido means apply to the painful side.
Okay. These location ones, and especially seeing OD and now BNO potentially meaning different things, it really drives home a key point from the source, doesn't it? Yeah. Context is everything.
Absolutely critical. You can't just look at the abbreviation in isolation.
So that covers a lot of the pharmacy bucket, as you call it, the instructions for taking medicine.
Right.
Now, let's switch gears to that other main area the document covers, the broader medical field abbreviations, the stuff you'd see more on charts or reports or test results, maybe.
Yeah, okay. Yeah, this list includes common measurements, like BP for blood pressure. And guess what? The source flags this one, too. BP can also stand for British Pharmacopoeia, like a standards book.
No way. Okay, BP, blood pressure, usually.
What else?
BMI is body mass index. BS is blood sugar. BSA is body surface area. Pretty standard stuff there.
And lab tests.
Loads of those. The document lists ESR, that's erythrocyte sedimentation rate, FBC for full blood count, HB for hemoglobin.
Okay.
And those cholesterol terms people hear about, HDL, LDL, and VLDL for the different types of lipoproteins.
High density, low density, very low density.
Right.
Other basic measurements, H for height, what's for weight, INR for international normalized ratio, that's for blood clotting, and LFT for liver function test.
LFT, yeah, hear that one a lot. What about scans and stuff?
Yep. Imaging and diagnostic procedures have their own codes. CT scan for computerized tomography, MRI for magnetic resonance imaging, ECG for electrocardiogram for the heart, EEG for electroencephalogram for the brain, CXR for chest x-ray.
Okay, those are pretty common.
And remember, up by VP, we said hold that thought.
Yeah, you said intravenous push before.
Well, in this medical context, the source lists IVP as meaning intravenous pyelogram. That's a type of x-ray for the kidneys using dye.
Wow. Okay, so same letters, IVP, totally different procedure depending on context. That's potentially confusing.
It really highlights the issue. Then you have abbreviations for conditions or diagnoses or just notes in a chart. AF is atrial fibrillation, DVT is deep vein thrombosis, DX just means diagnosis.
Need X for diagnosis, huh?
MRSA, that's methicillin-resistant Staphylococcus aureus. A good one to see on your chart, though, is NAD. Nothing abnormal discovered.
Ah, okay. That is a good one.
History is often shortened to HO or HX. Investigations is IX.
HX for history. Got it.
And remember B and O, both nostrils.
Yeah. What's the other meaning?
Well, in the medical chart context, BO means bowels open, and B&O means bowels not open.
Bowels not open. Completely different from both nostrils. Okay, that's a really clear example.
Isn't it? The source also lists other procedures or samples. EUA is examination under anesthesia. GA is general anesthesia. LA is local anesthesia. NG means nasogastric, like a feeding tube.
Okay.
And notice this, the document lists multiple ways to say nothing by mouth. You might see NPO or NP or NPO or NBM, which stands for nil by mouth, all mean the same thing.
NPO, yeah. Seen that before, medical procedures.
Exactly. CSF is cerebrospinal fluid. CVP is central venous pressure. Sample types like EMU for early morning urine sample and MSU for midstream urine sample. RL or RL is Ringer's lactate, a type of IV fluid.
Okay. Lots to keep track of.
And just a few general medical terms the source includes. RX, sometimes written RX, that fancy R symbol, RP, they all mean take, or basically prescription.
An RX symbol.
Rep means let it be repeated, so for refills. Et just means and PPT means prepared.
Okay. So pulling this all together, here's where it gets really, really interesting. The source explicitly points this out. Some of these abbreviations have multiple completely different meanings.
Yeah, we've hit on a few already, like BNO.
Yeah.
Both nostrils and bowels not open.
And BP, blood pressure, or British pharmacopoeia.
OD, everyday or right eye.
IVP, intravenous pyelogram or intravenous push.
And the source also lists MS or MSO4. Now, that could mean morphine sulfate, or it could mean magnesium sulfate.
Oh, wow. That one sounds potentially really dangerous if there's confusion.
Extremely. Which raises that crucial question this document sort of implicitly answers, doesn't it? How on earth do healthcare professionals navigate this?
Right. The fact that this list exists and points out these ambiguities suggests they must rely heavily on training and the context. Where they see the abbreviation, is it on a prescription? Is it in a chart note?
Absolutely. Context is king. And the source also shows us those variations for the same instruction, like OD, OD, and IN, all meaning daily, or all those different ways to say as directed.
And it even mentioned regional differences, like OD being preferred over QD in the UK for every day.
Yeah, so layers of complexity there.
So, okay. What does all this mean for you listening? Why should you care about all these cryptic codes?
Well, understanding even just the common ones from this list can really change how you engage with your own health information. You can look at your prescription bottle and actually understand the instructions with more confidence.
Or you might have a better shot at understanding notes in a medical report you get, or a lab slip. Feels less like a foreign language.
Exactly. It's about bridging that communication gap. You know, in healthcare, efficiency is so important, so this shorthand is essential for providers. But being able to decode it yourself, that empowers you to be a much more active participant in your own care.
It is fascinating, though, how much critical information gets packed into just 2 or 3 letters.
Yeah.
Makes you appreciate the precision needed.
It really does. But it also makes you wonder about that balance, you know, between the efficiency that shorthand offers and the need for absolute crystal clarity in medical communication, especially now with electronic records, information being shared maybe between different places.
Yeah, the potential for misinterpretation across systems or between people seems like a real challenge.
Absolutely. Which leads to maybe a final thought for you to consider based on everything we've seen in this source.
Okay.
Given that potential for ambiguity, the double meanings we saw, how vital is it really for healthcare providers and patients to take that extra moment to verbally confirm instructions and meanings, even when the shorthand seems obvious?
Should we always double check just in case, even if it says OD, maybe just confirm, so that's once a day, or that's the right eye? That's definitely something to mull over next time you encounter these abbreviations.